Learning Basic Health Statistics, Part 1, Public Health Workers Guide, by Engineer Maria Elizabeth P. Baba. Part 1, Basic Health Statistics. Topic outline. 1. The three main categories of basic data in health statistics, and 2. The three frequency measures used in the computation of health statistics. The three main categories of basic data in health statistics. 1. Population. 2. Vital statistics, and 3. Health program indicators. Definition and uses of population. Here are some definitions and uses that you should be familiar with. Population is defined as a distinct group of individuals of the same species living and interbreeding within a given area, whether that group comprises a nation or a group of people, with a common characteristic at a specified time. Next is the population census, or POPCEN. It is the total process of collecting, compiling, and publishing demographic, economic, and social data pertaining to a specific time to all persons. The Office of the Philippine Statistics Authority, or PSA, is responsible for the conduct of population census every 5 years, and to come up with population projection. Population projection is defined as the estimates of the population for future dates. Uses of population projections can also alert policymakers to major trends that may affect economic development. Help policymakers craft policies that can be adapted for various projection scenarios. Government policymakers and planners around the world use population projections to gauge future demand for food, water, energy, and services, and to forecast future demographic characteristics, and one of the most important use of population is in the computation of almost all of the vital health statistics and health programs indicators. The next main category is the vital statistics. Definition and uses of vital statistics. Vital statistics is defined as quantitative data relating to births, deaths, marriages, health, and disease. They are the statistical outputs under the civil registration system, also known as the vital statistical system. What is a vital statistics system? A vital statistics system is defined as the total process of collecting information by civil registration or enumeration on the frequency or occurrence of specified and defined vital events, for example, births, deaths, etc., as well as the relevant characteristics of the events themselves and the person or persons concerned, for example, age, sex, etc., and compiling, processing, analyzing, evaluating, presenting, and disseminating these data in statistical form. As mentioned earlier, vital statistics are the statistical outputs under the civil registration system. Local Civil Registry Office. This office is responsible to register all the vital events, live births, deaths, fetal deaths, and marriages, and other civil status events pertaining to the population that occurred in their respective areas. Every city and municipality in the Philippines has a local civil registry office, and registration of these events is by place of occurrence, not by place of residence. Definition and uses of health program indicators. Health program indicators are sets of indicators identified to track progress of the implementation of the different health programs, for example immunization, maternal care, family planning, infectious diseases, non-infectious diseases, including vital health statistics, morbidity, etc. Any of a variety of measures that indicate the state of health of a given population, for example, mortality rate, morbidity rate, fertility rate, percentage of fully immunized children, etc. Uses of health program indicators. Used to compare the accomplishments among areas of jurisdiction. For example, barangays, municipalities, cities and provinces. For example, the percentage of FIC accomplishment, barangay A, equals 65%, and barangay B, equals 85%. Accomplishment of barangay B is higher compared with barangay A. Can be used to measure accomplishments over time. To determine if health services delivery, improving or declining, or performance coverage increasing or decreasing, etc. For example, barangay A, percentage of FIC 2018, equals 65%, percentage of FIC 2019, equals 75%. The accomplishment for percentage FIC coverage increased from 65% in 2018 to 75% in 2019. Can also be used to enhance active monitoring of services delivery to increase public accountability and good governance. The 3 frequency measures used in the computation of vital health statistics: 1. Ratio, 2. Proportion, and 3. Rates. What is a ratio and its uses? Ratio is a comparison of two numbers. It is indicated by the quotient of one quantity, the numerator, divided by the other, the denominator. Ratio equals numerator divided by denominator. It is used to describe the relationship between two numerical quantities without taking particular consideration to time or place. A ratio can compare variables of same type of objects. For example is the sex ratio. Sex ratio is computed the number of male in a population divided by number of female in the same population. A ratio can be variables of different type of objects. For example is the health worker, for example nurse. Ratio to population is computed as the number of population in an area divided by the number of nurses assigned in that same area. The numerator and denominator of a ratio can be divided by either the value of the numerator or denominator, and result is equal to 1. Example for this ratio is 25,000 over 2, divided by the value of denominator 2. The ratio 25,000 over 2 divided by the 2 over 2 is equal to 12,500 over 1. The result is, the numerator is equal to 12,500 and the denominator is equal to 1, therefore, the ratio is 1 per 12,500. The measure may be written as two numbers separated by a colon, 1 is to 12,500. Proportion, rate and percentage are types of ratios, and the fraction can be multiplied by 1, 10, 100, 1,000, 10,000, 100,000, etc. This multiplier varies by measure and depending on the desired comparison level. A proportion is a kind of ratio in which the denominator includes the numerator. Proportions may be expressed as a decimal, a fraction, or a percentage, and a percentage is a special type of proportion where the ratio is multiplied by a constant, 100, so that the ratio is expressed per 100. Rate and its uses. Rate is a measure of the frequency with which an event occurs in a defined population over a specified period of time. A comparison between two measurements of different units. In vital statistics, it shows the relationship between a vital event and those persons exposed to the occurrence of said event, within a given area and during a specified unit of time. It is evident that the persons experiencing the event, the numerator, must come from the total population exposed to the risk of such event, the denominator. For example are crude birth rate, crude death rate, infant mortality rate, etc. Particularly useful for comparing disease frequency in different locations, at different times, or among different groups of persons with potentially different sized populations. The total number of events, or count, divided by the projected mid-year population of the selected geography and multiplied by a constant, which is a multiple of 10. Typical constants used for public health rates include 100, 1000, 10,000, or 100,000. This multiplier varies by measure and depending on the desired comparison level. Rates can be crude or general rates and specific rates. Crude or general rates are rates referred to the total living population. It must be presumed that the total population was exposed to the risk of the occurrence of the event. For example are crude birth rate and crude death rate. Specific rates are rates in which the relationship is for a specific population group. It limits the occurrence of the event to that portion of population definitely exposed to it. For example are age-specific fertility rate and age-specific death rate.
Thanks for watching. Please share and subscribe to my channel and watch out for the next video.